common problems of digestive system are very much important to understand the disease processes of all the animals, particularly the sheep and goats. The nature of grazing, although this habit of grazing keep these animals away from almost many diseases that are commonly seen in large ruminants. I tried to compile this all presentation in following points: the significance of digestive problems in sheep and goats, then the types of digestive problems, then the common problems of digestive system in sheep and goats. After that, we will discuss on diagnostic approaches, then in last, conclusion and summary. So first, the significance of digestive problems in sheep and goats. As we all know that the etiological structure of this disease system, digestive system, is very complex and diverse and have the largest percentage of all the diseases. So this impact as the significant economic losses associated with the digestive system problems and high mortality and treatment cost. So if the animal having any problem of digestive system, there will be the decreased production performances and the price value of the animal. So this digestive system diseases of young and newborn animals is still feel that this is the more serious concern to all the farmers, veterinarian and scientists, because there are so many diseases that affect the digestive system of young and newborn animal, and they are until uncontrollable. Though there are now advanced practices are being introduced, but still they are feel that the disease of young and newborn animals is more serious concern to all. There has been a study 25 years around 1988 to 2012, that retrospective study was conducted at the ICR Central Institute of Research on Goats, Maktu, Mathura, and it was conducted by Pavaya et al. In the year 2017. And this study revealed the significance of this digestive system problems. In this study, the results revealed that the adult females showed higher mortality rate than the males due to intestinal diseases. Secondly, the mortality rates reported were highest for the enteritis. It is around 43%, followed by John's disease, hemochromatosis, inanition, gastrointestinal parasitism, tympani, and enterotoxemia. The gastrointestinal parasitism and hepatobiliary diseases cause around 51 and 45 mortality during the rainy season, respectively. So, by this study, we can easily understand the significance of the problem of digestive system, particularly the sheep and goats. Now, coming to the types of digestive problems in sheep and goats, we can easily group these problems into two categories. They are either infectious or clinical. Infectious, and these are always regarded as herd level problems, and the onset is always acute, or sometimes per acute conditions are there due to this infectious problems. Second category, we can say they are individual or animal affected. So these are regarded as clinical problems and affects the individual animals. And these can further be subdivided into following three categories. Either it may be due to animal origin itself. So there may be some anatomical defects. They may be either acquired or congenital. For example, malocclusions due to improper mastication, indigestion, and inanition. These anatomical defects makes the animal unable to prehense accurately. So other animal origin causes as the infectious or systemic or deficiency diseases. They may cause occurrence of this digestive problems. Then lastly, the specific system or organ of this digestive system may cause the problems, for example, bloat, ruminal acidosis, abomasal infection, etc. Then the clinical problem may be of food origin, and the food quantity and quality affects the occurrence of these diseases. And in last, the managemental practices like stall feeding, grazing, housing practices, they also contribute the occurrence of these gastrointestinal diseases in sheep and goats. So among the infectious diseases, first one, the bacterial diseases are there. For example, actinomycosis, actinobacillosis, oral and laryngeal necrobacillosis, enterohemorrhagic E. coli infection, brachy, enterotoxemia, jejunal hemorrhage, paratuberculosis. These are the most common bacterial conditions that affect sheep and goat and cause the alimentary tract dysfunction or diseases in sheep and goats. Now coming to the viral causes of alimentary tract of sheep and goats, first and most one is the P. Pestidespititis ruminants. Then it also known as goat plague, quota, ovine rinderpest, plague of small ruminants. So this PPR is now also regarded as the most serious concern to all the research institutes as well as the farm practitioners. The second category of viral diseases is bovine viral diarrhea, winter dysentery. Bovine viral diarrhea is thought to be a cause of diarrhea in bovines, but it's still the sheep and goat affected at a same percentage, and this winter dysentery is supposed to be caused due to some stress factor. Also, the coronaviral infection has been reported for this winter dysentery in sheep and goats. Among the parasitic diseases of alimentary tract of sheep and goats, there is again a very long list. Among this, the parasitic gastroenteritis caused by either cestode, trematode, nematode. Then hemoncosis due to Hemoncus contortus, Bunostomum hookworm disease caused by Bunostomum trigonocephalum. Next is esophagostomasis, that is nodular worm disease of sheep and goats caused by either Esophagostomum columbanium, Esophagostomum venulosum, and Esophagostomum asperum. The next disease, either chavertiosis, that is a nematode, Chavertia ovina, that localize in the large intestine. Then comes the stomach flukes, intestinal amphiostomums, that's for example, para-amphiostomum epilepticum, para-amphilostom cervi, Gastrophylax, chrominifer, and Fiscoideus species. So these list uh, indicates the number of parasites involved in causing the particularly the parasitic gastroenteritis in sheep and goats. The next category is the toxic diseases. For example, among most common, we can say the urea toxicosis is a very common finding in field condition because sheep and goat got opportunity freely during the cultivation time, and this urea toxicosis is seen all over, I think, India, and this causes the ruminal alkalosis condition particularly. Among this, the next disease may be the chemically treated natural feeds and the diseases of alimentary tract of unknown etiology. Among this, the chronic inflammatory bowel disease of sheep like humans, and second one is the salivary amoebism diseases. So this category, I tried to categorize this condition clinical or infectious among these types of diseases of alimentary tract of sheep and goats. Now, clinical diseases. Among this, the specific disease of a organ or more organ at a time, they cause the disturbances in the digestive system of sheep and goat. Among this, the disease of rumen and red rheumatism, and it includes simple indigestion, rumen infection, ruminal lactic acidosis, subacute ruminal acidosis, ruminal tympany, traumatic reticuloperitonitis, vagus indigestion, traumatic reticulosplenitis, reticulohepatitis, impaction of omasum. So these are more or less same as for the large ruminants. The next diseases of intestinal system is diseases of abomasum. The displacement of abomasum, either right side or left side, volvulus, abomasal impaction, abomasal phytobazos, trichobazor, abomasal ulcers, omental bursitis, abomasal bloats. So these diseases are related to the abomasum. The next categories diseases of the intestine that include small and large intestinal obstruction, enteritis, dysentery, protein losing enteropathies, terminal ileitis of lambs, cecal dilatation, and cecocolic volvulus. We will discuss one by one the common digestive problems in sheep and goats. So coming to the first disease of today's discussion, that is indigestion. So indigestion, it may be either simple or secondary, and disruption of normal reticulorumen function is known as indigestion. So particularly indigestion is a group of problems that involve abnormal forestomach motility or abnormal fermentative activity, which in turn lead to abnormal reticulorumen contents, and that defines the type of indigestion such as ruminant acidosis, vagal indigestion, and frothy bloat. So this subject of this section are probably the most common types of indigestion, but are also the least dramatic and least clearly definable. So this indigestion is a very primary dysfunction of this rumen forestomach motility. So either maybe abnormal forestomach motility will be there, or there may be abnormal fermentative activity in the stomach of sheep and goats. So this indigestion seems a very common problem, but it impacts overall health, or we can say the overall production performances of animal. So as a clinician, as a veterinarian, as a field veterinarian, we must focus if the production or performances of the animal is not optimal, there may be chances of certain types of indigestion. So we have to search out the causes, and then the actual treatment or the management practices improvements must be suggested to the owners. So this simple indigestion rarely seen in sheep and goats due to their nature of feeding or habit of grazing. But the onset, as acute onset, it is not seen commonly, but it can occur in an individual animal or in several members of a group due to some dietary changes or some managemental variations. So this simple indigestion is always associated with an abrupt dietary change that results in a self-limiting but rapid decline in rumen fermentation. So if the dietary or rumen fluid change cannot be assigned to one of the more well characterized indigestions such as acidosis, alkalosis, or rumen putrefaction, it may be characterized always as simple indigestion. The secondary indigestion is a disruption of normal reticulorumen function as the sequelae of other diseases. So the sequelae of other diseases such as endotoxemic infection, abomasal diseases, and metabolic diseases, they causing indigestion, they are always known as or regarded as secondary indigestion in sheep and goats. It is similar to simple indigestion, but typically more chronic in onset because it follows the establishment of another primary disease entity. It confounds the clinician to accurately identify the primary disease, and it can delay return to normal health as the primary disease resolves. So secondary indigestion is also a serious concern to the field veterinarians and the clinician So we have to rule out the occurrence of this secondary indigestion, particularly related with abomasal diseases or other rumen conditions. So this indigestion results in inappetence, inanition, starvation, or partial anorexia. And this inappetence may sometimes occurs due to some anatomical defects, and these anatomical defects may be either congenital or acquired. For example, agnathia, micrognathia, brachygnathia, hair lip, cleft palate. So these are some congenital or acquired condition. Among these, eruption of tooth also included, and the overall effect of these condition is a malocclusion of the incisor with the dental pad, and that decrease the prehension and mastication ability of the animal, and consequently the body condition and production decreases, and this condition also results in increased risk of other conditions such as salmonellosis or other bacterial or viral infections due to the reduced or impaired immune system of animal. The treatment for these anatomical defects is always surgical, so the condition should be diagnosed promptly, accurately to rule out the condition of inappetence in sheep and goats. In this picture, we can easily understand the malocclusion of the incisor with the dental pad. So, due to this, the mastication and prehension abilities of the affected animals reduce drastically. So, in this slide, we can see the age of the eruption of tooth of sheep and goats. So, at the age of around 3 months, the first molar erupts, and at the age of around 1.5 years to up to 3 years, the almost all replacement of the teeth will be there. So this picture or this information suggests primarily about the any abnormality in prehension or mastication. Though the sheep are more adversely affected by lost incisor than goats, and the cheek teeth may wear unevenly and make chewing painful, and that may ultimately leads to inappetence or indigestion. In some animals, tooth root abscesses may be there, and they may result in cold sensitivity, leading to decreased water intake. The cheek teeth abnormalities are more difficult to determine because examination and visualization of the cheek teeth can be a challenge in case of sheep and goat. So, we have to diagnose the condition of improper mastication or indigestion due to tooth problems in sheep and goat. The lesions of oropharyngeal region of the digestive tract also cause inanition. So the inanition due to oropharyngeal lesions include they are occurs commonly due to after using the walling gun for drenching or feeding purposes. There will be necrotic stomatitis due to development of this Fusobacterium necrophorum, and affected lamb will show the poor growth and always have wet matted hairs around the mouth from excessive salivation. So if a lamb or new young kid having the excessive salivation or matted hairs around the mouth, this oropharyngeal lesion should always be searched and accordingly be treated. Sometimes respiratory signs may be developed due to development of infectious agents like abscesses or some other infection present in the lungs. So respiratory signs may develop due to presence of these oropharyngeal lesions. Coming to the next disease condition, this is esophageal obstruction. So this esophageal obstruction is also regarded regarded as less common in small ruminants than in cattle, and it is more common in sheep than in goats. Fortunately, choke in sheep usually is due to rapid consumption of feed pellets before saliva can moisten them. So, this condition is more common in sheep than in goats. Accordingly, the most cases of obstruction by feed material will resolve relatively quickly as the feed takes on moisture in the esophagus. But this condition is sometimes seen due to eating of some seeds, or like the mango seed or other ball type feed stuffs. So esophageal obstruction sometimes commonly seen in field condition in sheep and goat. The clinical signs in affected animals, the appear anoxious. So the restlessness present during this esophageal obstruction, this easily indicate presence of obstruction. So there will be excessive salivation related to the inability to swallow. Due to this obstruction, ruminal bloat develops, and this always develop due to complete esophageal obstruction. So the treatment of this obstruction is always passing a stomach tube, and if the bloat is persist, an emergency ruminotomy may be indicated. Placement of a large gauge needle or intravenous catheter or trocarization will help in resolving this obstruction. However, there should be a precaution should always be undertaken, as there is chances of contamination of abdominal cavity with the rumen contents. If the obstruction is prolonged, so this prolonged obstruction, esophageal obstruction, may always cause mucosal damages of the esophagus, and then causing scarring in the stricture in the esophagus, and make animal prone for future obstructive episodes with a poor prognosis, and the affected animal should be culled. The presence of intermittent regurgitation soon after eating and swelling of the distal neck. This condition always suggests presence for mega esophagus, though this is a rare condition. But if an animal having these signs, the presence of intermittent regurgitation soon after eating and the presence of a swelling at the distal neck, always make suggest for the presence of megaesophagus, and that can be diagnosed with endoscopic examination and a positive contrast radiography. So coming to the next condition, that is a very common condition, this is the bloat or tympany. So accumulation of free gases or froth in the rumen is known as bloat, and the sign of this bloat is always abdominal distension. This bloat is regarded as less common in a small ruminant. However, this goat being affected less commonly than sheep. So sheep develops bloat more commonly as compared to goats, and both animals, sheep and goat, have less occurrences of bloat as compared to other large ruminants. So the etiology of this bloat can be categorized into three types. First is the frothy bloat or foamy bloat or the pasture bloat, and this category is caused by the diets that promotes the fermentation or formation of the stable froth, and it is also known as primary ruminal tympany. Second one is the free gas bloat or grain bloat. It is caused due to diets and having the grains, and this diet promotes excessive free gas production. And third one is the free gas bloat, and that this free gas bloat accumulated due to failure to eructate. That is, the mechanical obstruction may be there, and it always regarded as secondary ruminal tympany. So the sheep and goats continually belch about once every minute to get rid of this gas. But when there is obstruction or overproduction of froth or free gas, the bloat scenes. The usually the free gas bloat is only seen in 1 or 2 animals, while frothy bloat can affect a number of animals in a flock or herd. The abdominal bloat is common in artificially reared lambs and kids in pre-ruminant age only. So it is thought that the rumen cannot develop up to the age of 2.5 months. So if the young animal, kid or lamb being fed artificially, there is chances of development of this abominable bloat always high in this condition. So coming to the pathogenesis of this free frothy bloat, it is usually associated with the ingestion of legume forages or hay, particularly the alfalfa hay, and with grazing on lush cereal grains pasture, but it also may occur with high grain diets. In the case of frothy bloat from a fine ground diet, usually the corn, a mucoprotein released from the rumen protozoa and stabilize the form at a low pH. In legume associated frothy bloat, plant chloroplast release into the rumen and that traps gas bubbles. So this procedure helps in accumulating the frothy bloat in the rumen. In case of free gas bloat, it also occurs with grain diets, especially if the animal are not adapted to that diet. And third category, failure to erectate, that is mechanical obstruction or secondary ruminal tympani. It may be occurs due to either physical obstruction of the esophagus, for example, in case of choke or swollen mediastinal lymph nodes, the disease of rumen wall like impairment of contraction and erectation, and some clinical condition like hypocalcemia, endotoxemia, pain, peritonitis, and some drugs like xylazine. They impairs the normal erection process and ultimately leads to the development of bloat in the rumen. The rumen may be either hypomotile or hypermotile, and both conditions are responsible for the occurrence of bloat. The bloat in lambs and kids can have the same cause as in adults, but also can be caused by improper milk feeding practices. The overfeeding, feeding of large, infrequent meals, and feeding spoiled or cold milk, these all have been associated with bloat in lambs and kids. So this concern is very important, and the farmers should always be advised about these practices so the development of froth or bloat can be prevented in lambs and kids particularly. Now coming to the sign of the bloat or tympani, the clinical signs of both frothy bloat or free gas bloat are the same, and it includes restlessness at repeated standing up and lying down, abdominal discomfort, frequent defecation and urination, respiratory distress, grunting, extension of the neck and head, increased salivation, animal may bite and kick at the abdominal region, the stomach becomes progressively distended on the left side and sound like a drum if tempted. So ultimately, it animal if not treated, there will be a chance of collapse and death. So this bloat have regarded always regarded as an clinical emergency. So diagnosis, it is very easy. On the basis of acute onset of abdominal distension and restlessness, we can easily diagnose the condition. The presence of bloat is always regarded as medical emergency, so diagnosis and treatment should occur almost simultaneously. So this point helps the clinician to save the life as well as to make diagnosis and treatment at a early stage. So coming to the treatment, as we all know that bloat is of two types. So this treatment involves the type of the bloat which is present, and the root cause should be first searched out and then eliminated. In case for treatment, we can say if the animal is not in immediate danger of dying, An orogastric tube can be passed and the gas can be relieved. Most cases of free gas bloat are relieved with passing of this stomach tube or orogastric tube. The froth encountered in frothy bloat caused by the ingestion of finely ground grains has a pH of less than 5.5. So in that condition, we have to keep the animal in a standing position to relieve the respiratory distress in animals. In case of free gas bloat, the passage of stomach tube or trocherization of rumen is always indicated. And if the obstruction cannot be corrected with the stomach tube or free gas bloat continue to develop and threaten the life, then trocherization of rumen is always advised. But caution should be undertaken while puncturing the rumen that it may lead to a septic condition and ultimately septicemia and death may encounter due to faulty trocherization. So, as a clinician, we must focus on relieving the gas by using some medicines or some passing of stomach tube. Otherwise, in case the uncontrollable free gas bloat or frothy bloat, the trocherization may be initiated. In this picture, we can easily see the site of trocherization. That is always the left paralumbar fossa. So while using the aseptic precautions, we can trocherize or we can use a 18 gauge or 16 gauge needle to pass through the rumen and the gas can be relieved easily if froth is present. Some disturbance in the release of this froth, so we use some medicines to make it easy to pass the gas with this needle. If no gas escape and foamy substances trickles out of the stomach tube, then the animal has frothy bloat. And we sometimes in field condition injected some either sweet oil or minerals. And coming to the in the treatment section, we will discuss. And this is a very common practice in field condition that we have to relieve the gas or the distension of rumen so that animal may not collapse. So for the treatment of frothy bloat, we can easily drench with anti-foaming agents like vegetable oils or mineral oils around 100 to 200 milliliter is quite sufficient. And some commercially available anti-bloat preparation are there in market like Timpanil or Blotosil. So many preparations are available, and we have to keep the animal on a standing position. Walking the animal and massaging the flank may also help in relieving the gas, and the cause should be determined either it is frothy or free gas. So the treatment should be attempted accordingly. If there is continuous occurrence of bloat, emergency ruminotomy may always be indicated. So coming to the prevention of this bloat, as with any disease, prevention is the best approach. The control measures should be included the avoiding of the diet that causing the occurrence of gas or froth. So the animal should be gradually, the change of diet should be gradual over a period of 2 to 3 weeks, and the animal should be offered the grazing for a short period only. The feeding of hay prior to pasture or concentrate is always indicated. Avoid feeding finely ground concentrate to the animals, especially in case of young animals. So the finely ground concentrate should always be avoided. And then make sure to provide adequate supply of water and provide salt supplementation so there will be no dehydration condition, and the feed should always be lubricated. If bloat encountered in multiple animals at the pasture group, the entire group should be removed from the pasture and reintroduced slowly after gradual acclimation and by the inclusion of ionophores in the diet. So this practice also helps in removing the actual cause of bloat. If only one or two cases of bloat are encountered, the healthy animals can remain on the offending pasture, but grazing should be limited to ensure the gradual acclimation of animals. Certain vegetables of varieties like legumes that are thought to be designed for intensive grazing system like alpha graze should be planted and managed in a manner that decrease the incidences of bloat, like limited or creep grazing. Grazing legumes with high leaf tannins concentrate like arrowleaf, clover, kujudu usually is safer because tannins help break down the rumen foam. So the monensin can be given at a dose rate of 15 milligram, and the lesolacid at the dose rate of zero point 0.5 to 1 milligram per kg per day in sheep and goat. These both practices decreases the formation of free ruminal gas. By enhancing the propionic acid formation, these drugs not only reduce the amount of methane produced in the rumen, but also improve the efficiency of nutrient assimilation from feedstuffs. So, by adopting these for certain measures, we can prevent the occurrence of bloat in sheep and goat, particularly in young animals. If rabies is known to be prevent in the area, do not put your hands on a sick animal's mouth, though, because due to presence of this harmful virus, there is chances of transmission. So, in case of rabies, the animal may have bloat. Exposure to the saliva of a rabid animal can transmit rabies to humans. So, this condition particularly true in case of esophageal obstruction where there is excessive salivation, or also in case of this bloat. So animal attendants or the veterinarian or the person who is dealing with these affected goat or sheep should always take care about these conditions of having rabies or certain other transmissible or zoonotic diseases. Now, coming to the next important disease of sheep and goat, that is rumen acidosis. This rumen acidosis usually occurs in animals that have been fed predominantly the forage-based rations and suddenly are given access to large amount of highly fermentable concentrate. So this is most common type of grains are rice, wheat, or barley. The common name for this condition, ruminal acidosis, are grain overload, but breads, candy, apples, and other fruits, beets, sugarcane, and potatoes also have been implicated as source of the excessive, easily fermentable carbohydrates. So, grain overload is a very common name for this ruminal acidosis. The possible reasons or etiology for this ruminal acidosis is sudden introduction of grain, either accidental or unplanned access, grazing in a newly harvested paddocks where there may be spilled grains or unharvested areas are there. The rapid rumen fermentation of highly digestible carbohydrates ingested in excessive amount, particularly if they are finely ground. So all these factors leads to the occurrence of this ruminal acidosis in sheep and goats. Coming to the pathogenesis, as it is a very important disease, we always seen commonly during daily practice. So in field condition, this ruminal acidosis is very common. So coming to this pathogenesis, the rapid fermentation of highly digestible carbohydrate causes the decline in the rumen pH, and this causes the proliferation of lactobacillus species present in the rumen fluid. Then this leads to the further lowering of the rumen pH that ultimately cause the rumen protozoa and many of the lactate users begins to die, and there will be increase in osmotic pressure in the rumen. Due to this increased osmotic pressure, the fluid is drawn from the systemic circulation into the rumen and resulting in dehydration and possibly hypovolemic shock. Ultimately, there will be systemic lactic acidosis that causes the damage to the epithelium and leakage of the bacteria and toxin into the portal and systemic circulation. The dehydration and hypovolemia shock further aggravated, and the lactate concentration increase in the blood, potentially leading to systemic lactic acidosis, shock, and death. So, this is the brief pathogenesis, and we all know about this. But the main thing is that as the condition occurs, if the animal having access to the highly fermentable carbohydrate, the condition develop depending on the amount and the nature of this grain or the carbohydrate. The clinical signs we all know very commonly, there will be depression, lying down, diarrhea, dehydration, animal always having increased thirst, bloating, segregate Shoher's instance, and sometimes the temperature falls down below subnormal level around 100 or below 100. Animal having the moaning sounds when we auscultate the animal having the lactic acidosis. The animal always shows the sign of pain exhibited through moaning sounds. So the auscultation of trachea helps in considering the condition. And sometimes when the condition has been advanced, there will be regurgitation, and there will be the vomiting through nostrils or through mouth in case of severely affected animals in last stage of the condition. The diagnosis can be made with the help of the estimation of the rumen pH, and it always falls below 5.5, and the pH around 5 4.8 is always regarded as critical. The rumen fluid itself is milky gray, and particles of the in-sitting feed may be noted. The protozoa counts in the rumen fluid may be reduced or absent, and large gram-positive rods may be seen on gram staining. The clinico-pathological laboratory data are consistent with dehydration, like increased PCB, total protein, perennial azotemia, and metabolic acidosis. Based on these clinico-pathological findings, we can easily diagnose the condition as ruminal acidosis. The liver enzymes GGT, AST, LDS, they also be estimated, and there will be elevated of these all enzymes. The leukogram can vary in appearance, ranging from normal to a degenerative left shift depending on the severity of the case. Sometimes urine analysis also reveals an increased specific gravity of the urine. Coming to the treatment should initiated as per the severity of the disease. So it is always symptomatic. First, the use of intravenous fluid, so correction of the cardiovascular shock, dehydration, acidosis, toxemia, and removing or neutralizing the offending feed stuff is primary concern. The choice of fluid is always either NS or the Ringus lactate. The intravenous fluid containing 5% or 7.5% sodium bicarbonate is always indicated. Oral fluid are contraindicated because absorption is diminished, potentially increasing the rumen distension and worsening the animal's discomfort. So we advise the owner not to offer the plentiful water, and if the animal having high thirst, the water should be offered in small quantity. Sometimes we use some antihistaminic preparation. Also, NSAIDs like flunixin, meglumine, they help in relieving the pain. The oral magnesium oxide or the neutralizing substances may be helpful in relieving the acidic nature of the rumen contents. Oral antibiotics have been recommended to kill rumen microflora and stop fermentation. However, some clinician believes that these agents are contraindicated because the gram-negative anaerobes that need to flourish to re-establish normal rumen microflora are susceptible to most antimicrobials. effective against lactobacillus species. So this is a controversial practice. Sometimes when animal having some diarrhea or any severe condition, some clinician advise this condition, but certainly this is a contraindicated practices until there is a need to use oral antibiotics in case of ruminal acidosis. Removing the substrate for growth of lactobacillus organism is more effective. Sometimes we advocate the rumenotomy in severe cases. After the rumen pH is corrected, transformation of the rumen microflora with approximately one quarter of rumen float from another small ruminant is beneficial. And for this slide shows the practice of transformation. So the collection is easiest from the rumen of a fistulated adult cow. If a fistulated cow is unavailable, fluid can be collected through a weighted orogastric tube. Alternatively, fluid can be collected from any normal ruminant at slaughterhouses. Handling also easy. Rumen contents collected from a fistulated cow or at a slaughter can be strained through a gauze or cheesecloth to separate the fluid from the fibrous contents. The fluid collected through a weighted tube should be ready for storage, and the storage of rumen fluid ideally should be administered immediately. However, it can be stored for 24 hours to 48 hours as the surface of the fluid is covered with a layer of mineral oil to maintain an anaerobic environment, and the open container is refrigerated. There should be a caution: do not store rumen fluid in a closed container because it may explode due to production of gases. So by this procedure, we can easily transfer or transformation of rumen fluid can be done from a healthy animal or rumen fluid collected from a slaughtered animal. So this helps in normalizing the rumen environment of the affected animals. The next ingredient for the treatment is thiamine supplementation, and it can be used at the dose rate of 5 mg per pound body weight intramuscularly. It has been recommended at least for 2 times, but sometimes it may be used for 3 or 4 times in a day until rumen function returns to normal. In certain instances, calcium may be indicated as the animal having subnormal temperature, and this can be added to the intravenous fluid as calcium gluconate, but the clinician should avoid mixing this calcium salt and sodium bicarbonate at a single time. So while using calcium and the sodium bicarbonate, they should be used separately. The chronic sequelae to rumen acidosis, these are very important in understanding the actual pathogenesis of this ruminal acidosis. So prolonged conditions of ruminal acidosis always cause ruminitis, and this may be either fungal. There may be occurrence of laminitis and liver abscesses, and however these are less commonly encountered in sheep and goats than in cattle. But certainly this sequelae of ruminal acidosis is very serious concern to the clinician and particularly the field veterinarians. This damaged rumen lining takes up to 6 weeks to repair. So, by this point, we can easily understand the significance of or the recovery rate or prognosis of a animal having the ruminal acidosis. It takes around 6 weeks to repair the damage in the rumen wall. These animals tend to become long-term poor performers. So culling is best option in these conditions. The subacute ruminal acidosis also is a very serious concern for the field veterinarian, particularly because this condition, subacute ruminal acidosis, has been regarded, or we can say has been neglected, because the animal having low pH, but it is not causing any disturbances in the digestive system. But this subacute ruminal acidosis also has been regarded as a serious condition because it causes the chronic thiamine deficiency, and ultimately there will be cerebrocortical necrosis, and this condition ultimately leads to the occurrence of more serious conditions like polioencephalomalacia and pregnancy toxemia condition in sheep and goat. So subacute ruminal acidosis should always be suspected in case the owner or the farmer offering continuously the grain diet to sheep and goats, and this always the owner or farmer should always suggested for this condition. So the subacute ruminal acidosis condition also is a very common condition. However, it has been regarded as more neglected or not noticed condition in field condition. So prevention of this ruminal acidosis can be made easily by gradual introduction to grain or pellets. Coming to the differential diagnosis, there are certain diseases conditions like polioencephalomalacia, salmonellosis, pulpy kidney disease, pregnancy toxemia, hypocalcemia. These conditions should always be differentiated from actual or clinical ruminal acidosis condition. So polioencephalomalacia condition, as we are discussing in previous slide, it is caused due to subacute ruminal acidosis condition, and there is cerebrocortical necrosis due to the destruction of thiamine vitamins due to the occurrence of thiaminase bacteria, and star grazing posture is the clinical classical sign of this polioencephalomalacia. And when we inject the B1, the animal respond very quickly, and this helps in differentially diagnosing the condition from actual ruminal acidosis. Salmonellosis also a disease condition caused due to bacteria, but having the animal will have certainly the direct signs. In case of pulpy kidney disease or enterotoxemia, the animal having the history of sudden acute toxemia, direct signs will be there. And this condition, as we all know, then field condition, pulpy kidney disease or enterotoxemia always seen just after rainy season. Though, so the occurrence of this condition, the acidosis like condition during just after rainy season should always be suspected for the presence of pulpy kidney disease. The pregnancy toxemia can be differentiated with actual ruminal acidosis condition by having the history of pregnancy or having the multiple fetus. Hypocalcemia also may sometimes confuse with this ruminal acidosis, but when we inject calcium, the animal will respond instantly, and this helps in making the diagnosis for hypocalcemia confirmatory. The next condition or disease of sheep and goat digestive system is rumen infection. This rumen infection can occur after dehydration, blockage of the omasal orifices by a foreign body, sand ingestion, or consumption of diet high in fiber and low in digestibility. Rumen infection with plastic trash bags has become a growing problem worldwide. The signs of rumen infection are non-specific, but the rumen always will be firm. It usually can be palpated in the left flank, and the feces may be scanty and dry. The treatment, as we all know, the treatment for rumen infection is symptomatic. So the animal having dehydration, he needs intravenous fluid therapy, and the some laxative or purgative preparation are help in relieving the infection. Oral fluids containing magnesium sulfate at around 60 gram, but rumenotomy is required in severe cases. So rumenotomy helps in relieving the infection. Otherwise, symptomatic treatment helps in relieving the infection of the rumen in sheep and goat. And this condition is seen sometimes due to feeding of certain high grain diets or when the animal having dehydration. Coming to the next disease of digestive system of sheep and goat, this include the diseases of abomasum. So in this section, the abomasal bloat or abomasal tympani is first disease. So this abomasal bloat or abomasal tympani is one of the most common problem in lambs that feed on the lactose. So the etiology is Clostridium perfringens type A and a species of Sarsinia bacteria that gains entry with the unhygienic conditions and with the hot milk as a milk replacer. So this abomasal bloat or abomasal tympani occurs because the gas cannot escape from the abomasum, and the abomasum becomes more acidic with and that damage good bacteria. The clinical signs: the swollen belly, dull and lethargic animal, abdominal pain, that is colic, grinding of teeth, rapid onset, and the acute onset within 30 minutes of feeding. And sometimes the animal may found dead without showing any sign. So the death is the first sign in case of this abomasal. So this picture is showing the sign of this abomasal bloat or tympani in new, or we can say young lamb. So the risk factor for abomasal bloat or abomasal tympani, it occurs most commonly at the age 2 to 4 weeks of age in lambs, and at later age in kids. It compromises immunity from inadequate colostrum intake, poor hygiene and poor sanitation, use of poor quality milk replacement, overfeeding or infrequent milk feeding, that is twice daily, feeding too rapidly, ingestion of foreign bodies like hairs or coarse plants, milk replacer, incorrect mixing ration of the milk replacer, feeding milk that is too hot or cold. Milk replacer should be fed at 38 degrees centigrade. So by adopting these removal of these risk factor can easily help in preventing the occurrence of abomasal bloat in sheep and goat, particularly in young lamb and kids. Coming to the treatment of this abomasal bloat, the bloat can be dissolved as much baking soda as possible in 10 milliliter of water and administer orally with a syringe to neutralize the acid. In severe circumstances, a needle can be inserted into the abomasum to relieve the gas. Around 70 to 100% death are common due to this abomasal bloat. If not attended, abomasum may rupture, causing the lamb to die. Prevention of this abomasal bloat can be attended by using the good hygiene practices, avoiding of overfeeding, adding probiotics to the milk, offering yogurtized milk. Yogurt milk should not be introduced until after 7 days of age. So by adopting these points, we can easily prevent the occurrence of abomasal bloat in lamb and kids. The next condition of abomasal is abomasal impaction. It is similar to rumen impaction, usually occurs when poor quality roughage is fed, but it also can be seen with foreign body obstruction of the pylorus. Goats appear to be more commonly affected than sheep. Pregnant animals may be more prone to this condition. Clinical signs: affected animals usually are anorexic. There will be mild distension of the ventral abdomen, and it is characteristic sign. In some cases, the firm abomasum can be palpated through the abdominal wall on the right side. Weight loss may be apparent. Diagnosis can be made on the basis of clinical pathological evaluation, and it may be normal or mild hypochloremic metabolic alkalosis may be there, and there may be elevated rumen chloride concentration greater than 50 milliequivalent per liter. So these clinical pathological parameters help making the diagnosis of this abomasal infection. So the dietary changes are the primary treatment. Oral administration of mineral oil are the most commonly used treatments. Abomasotomy can be attempted, but prognosis is always poor with or without surgery. The prevention can be made with the changes in the dietary manipulation to improve feed or forage quality is the best mode of prevention. Next condition is abomasal emptying defect. This is also sometimes seen in field condition and similar to abomasal infection, mostly seen in large size breeds of sheep and goats. There will be the underlying cause is unknown, but the proposed pathomechanism is an acquired dysautonomia from neurotoxic. So this autonomia means dysfunction of the nerves that regulate the non-voluntary body functions such as heart rate, blood pressure, and sweating. This autonomia from neurotoxicosis has been regarded as the primary cause for this abomasal emptying defects in sheep and goats. Unlike abomasal infection, this disease is associated with concentrated feeding and often occurs around lambing time. The clinical signs are chronic weight loss, abdominal distension, and anorexia. The clinicopathological laboratory findings are always the animals are has been described as for abomasal infection are same. At necropsy, the abomasum is greatly distended and the contents may be liquid or dry. The treatment for this defect is use of laxative, cathetic motility modifiers, and abomasostomy has been mostly successful. So this condition sometimes seen in field condition, or we can say this is unnoticeable condition and seems like just vagal indigestion in large ruminants. So this abomasal emptying defects seen present, but sometimes it is overlooked or cannot be diagnosed in field condition. So the clinician having opportunity when the condition of abomasal emptying defects at looking for abomasal infection, this condition of autoimmunization should always be considered as a cause for this abomasal emptying defect in young animals, particularly of large size breeds. This coming to the next disease condition, that is enteritis, and we all know that this enteritis is the main contributory factor or contributory condition that affects the digestive system, not only the sheep and goat, but always all animals, or we can say that the digestive problems in terms of enteritis are very common, and also these condition also leads to great mortality conditions in field conditions also. So I try to cover this topic of enteritis and divide this condition into two parts: diarrhea in lambs and kids. So this diarrhea in lambs and kids is more serious concern, and the etiological factor also very vast. So the complex multifactorial disease of diarrhea in lambs and kids that involve the animal's susceptibilities, the environment, the nutrition, the presence of infectious agent, bacteria, virus, fungal, and protozoan parasites, and the management practices. The pathophysiology of infectious diarrhea in calves, lambs, and kids is quite similar. Despite improvements in management practices and prevention and treatment strategies, diarrhea is still the most common and costly disease affecting neonatal ruminants. So coming to the types of the diarrhea or enteritis in lambs, first etiology is enterotoxigenic Escherichia coli, E. coli infection. It seems in lambs and kids younger than 10 days of age, but is most common at the age of 1 to 4 days. usually manifested as an outbreak in lambs and kids between 12 and 40 hours of age. So this is cause high mortality in young lambs and kids, as in case of calves. And this E. coli infection or colibacillosis is a very common condition encountered in field condition. The signs of this E. coli infection are always secretory type diarrhea with excessive bicarbonate loss along with severe acidosis. So the affected lamb and kids quickly became dehydrated and recumbent and cause high mortality if animals are not treated promptly. The diagnosis of this condition, E. coli, can be made with the help of fecal culture and serotyping for the presence of this virulence factor K99 and F41. These are the virulence factor for this E. coli. The histopathological evidence of colonization of the small intestine can support a diagnosis, and the presence of this E. coli O157S7, we all know that this organism has a zoonotic implications. So this condition has been reported as a zoonotic significance in field conditions. So we all must know about this zoonotic significance of this E. coli infection in field condition. Now coming to treatment, there will be supportive and symptomatic treatment. We have to correct the dehydration, the alkalosis, and the other symptomatic treatment are always indicated to treat the condition of E. coli infection. Oral use of neomycin or trimethoprim and systemic ampicillin or amoxicillin may be beneficial, but sometimes in field condition, presently oxytetracycline has been considered as a best option to treat orally, especially orally for the E. coli infections. So the use of either neomycin, trimethoprim, ampicillin, and amoxicillin intramuscularly and orally, but still the results of using this oxytetracycline are always rewarded. So we can use this tetracycline in field condition, and this has been reported as having very good effects on the controlling this E. coli infection in field condition. Coming to diarrhea in lambs and kids due to rotavirus infection. So this rotavirus causes diarrhea in lambs and kids at the age of 2 to 14 days, and but older animals also be affected. The lambs and kids are infected with the group B rotaviruses. The clinical signs included villus atrophy and malabsorptive type diarrhea. Affected animals become very depressed and dehydrated. Diagnosis of this rotavirus made on the with the help of electron microscopy of the fecal or colonic samples or by immunological techniques. Treatment supportive and symptomatic. Next category is diarrhea in lambs and kids due to Cryptosporidium species. The etiology is Cryptosporidium parvum. The causes are malabsorptive diarrhea similar to rotavirus infection. Unlike other protozoal agents such as the coccidiosis, this Cryptosporidia do not require fecal excretion for sporulation to become the infective stage. So the sporulated they sporulated in the gut, whereupon approximately 20% become immediately infectious to other villus tips cells without leaving the intestine. So this nature helps in establishment of the infection in the gut. The clinical sign of this Cryptosporidia diarrhea includes the diarrhea in lambs and kids at the age of 5 to 10 days. Affected animals often are active, alert, and nursing, unlike the disease of caused due to E. coli and rotavirus. The diarrhea stool usually are very liquid and yellow. Diarrhea can range from mild and self-limiting to severe, especially with mixed infection. However, the relapses are quite common, and this organism usually occurs as a component of mixed infection. So this Cryptosporidia species has been regarded as a self-limiting, but there are chances of relapses are quite common. The diagnosis of this organism can be made with acid-fast staining techniques and by using the PCR techniques or immunological and histopathologic techniques. The Cryptosporidia also have zoonotic significances. Treatment: there is no effective treatment for this Cryptosporidia. Only symptomatic and supportive care should always be undertaken. The prevention through the decreased exposure. So the exposure of healthy animals should always be controlled in case in a herd having the history of this Cryptosporidia infection. Coming to next category of diarrhea in lambs and kids due to salmonella. So this condition causes diarrhea in lambs and kids of any age. It is not limited to the young age, but it can cause diarrhea at any age. The invasive enterotoxin cause severe inflammatory diseases and necrosis of the lining of the small and large intestine. So the clinical signs of this diarrhea include that animal younger than 1 week of age are more likely to die acutely before onset of clinical signs, whereas animals older than 1 week are more likely to have diarrhea. The acute onset of fever, depression, tenesmus, and shock occasionally is observed in case of diarrhea due to this organism. And the salmonella-induced diarrhea stool is more likely to contain blood. Diagnosis of salmonella can be made on the basis of culture, histopathological examination, PCR techniques. The diarrhea feces occasionally may contain blood, fibrin, but many animals die before this development is observed. This enteric salmonellosis also is a zoonotic disease. Treatment: supportive care and parental administration of antimicrobial therapy after having the results of antibiotic sensitivity test, that is ABST. However, safety of sodium at the dose rate of 1.1 to 2 milligram per kg intramuscularly twice daily, or use of trimethoprim sulfadiazine at dose rate of 15 milligram per kg subcutaneously or intramuscularly or intravenously only once a day can be administered until antimicrobial sensitivity test results are available. So at beginning, we can use this for sodium or trimethoprim combination to control the diarrhea due to salmonellosis in field condition. Coming to next organism, that is diarrhea in lambs and kids due to giardia. This condition is more commonly seen in but not limited to the 2 to 4 weeks old lambs and kids. The diarrhea usually is transient, but infected animals can continue to shed cyst for many weeks even when they appear to be clinically normal. Diagnosis made with the iodine stained wet mounts of feces or tissues, immunological techniques. Giardia is also potentially a zoonotic condition. Treatment can be made with the help of fenbendazole at the dose rate of 5 to 10 milligram per kg twice daily for 3 days or once daily for 5 days. And this can also be historically been treated with oral metrinodazoles at the dose rate of 50 milligram per kg once a day or for 5 days. However, this use of metronidazole orally has been banned in United States. So using fenbendazole is more beneficial as compared to this metronidazole. Now coming to the nutritional diarrhea in lambs and kids, it is regarded as the most common in orphaned animals and usually is a result of improper management practices, and such as the use of poor quality milk replacer, milking errors, or infrequent feeding of large amounts. Diarrhea resulting from consumption of less pasture or highly energy ration also a commonly seen in and usually regarded as self-limiting disease. The incidence of this form of gastric upset can be minimized by a slow introduction over a period of 2 to 3 weeks to energy dense diets. So next condition is protein losing enteropathies in kids at a farm. So in this slides, I just compiled an information I used to deliver the online training programs, as I have additional charge as a officer in charge for Pashu Vigyan Kendra Rajubas. At it is situated at Abhika Nagar Tonk, just near the CSWRI Abhika Nagar. So a farmer, progressive farmers named Mr. Abbas Khan has always participated on online training, and I just contacted with over telephonically and got the information about disease, and then I tried to treat the condition on the basis of having history of having high protein diets. So here you can see the owner of the farmer, the progressive farmer. This farm is situated at Dungarpur, Rajasthan. You can easily see the cultivation of this napier grass, and also the animal having free access to high grain feeding maize and grams and chana churi, gram churi, pulses. So they are offering high protein diets to the dams as well as to the newborn and young lambs and kids. So the animal suffered with diarrhea, and then ultimately they farm encountered mortality. And Mr. Abbas contacted me on telephone, and I got the detailed information. Then I suggest some changes, and then the condition was controlled. So this protein losing enteropathies are also regarded as very common in field condition. So by having the detailed information about the ration or the diet, we as a clinician can easily understand the nature of the disease, and then we able to control or eliminate the condition accordingly. In this picture you can easily see the nature of the feed or ration being offered at that farm. And now
ये सर ये जो नए बच्चे ना वो इस तरह से चमकते हैं 10-15 दिन के। देखो ये अच्छे खेलते हैं, ये वाले, ये दो बच्चे जैसे नए हैं अभी अच्छा खेल रहे हैं, लेकिन ये जैसे कि अभी 2-2.5 महीने का बच्चा, इसके बाल इस तरह से हो जाते हैं सर, और वो लूज मोशन भी करना शुरू कर देते हैं और उनकी हेल्थ डाउन हो जाती है, और आंखों में सर लगातार इनके पानी गिरता है सर कुछ बच्चों के। जैसे ये अभी ये देखिए सर, इनका शाइनिंग में थोड़ा फ़र्क आ जाता है। जैसे ये 2.5 महीने का बच्चा हो गया, ये जैसे 2.5 महीने का बच्चा, ये इस तरह से हो जा रहा है सर। 2.5-3 महीने का बच्चा है, ये जो चारा खा रहे हैं वो बच्चे इस तरह से हो रहे हैं। ये देखो सर, ये लूज मोशन भी कर देते हैं, कंट्रोल में भी आ जाते हैं, लेकिन वापस बॉडी नहीं पकड़ते हैं सर। क्या कारण है सर इसका, जरा बताइएगा मेरे को।
Mr. Abbas giving all the details regarding the condition, and then suggest him some changes to stop, advise to stop the overfeeding of high protein diets, and then he got very good results and he was very happy. So by sharing this video, I just explain all the details what the owner or the farmer as a progressive farmer was offering a high quantity of protein as a daily practices, and ultimately by having diarrhea or mortality at his farm, he contacted me, and I just suggest some dietary changes and able to control the condition. In this second video also he is showing his personal
हमारा एड्रेस है अब्बास शिकली राज डेयरी फार्म,
information.
खाटवाड़ा, खड़गदा, तहसील सागवाड़ा, डिस्ट्रिक्ट डूंगरपुर, राजस्थान में हमारा यहाँ फार्म है। इंटीग्रेटेड फार्मिंग में हमारे पास साहिवाल नस्ल की गाय एवं उसके बाद में सोजत नस्ल पे हमने कार्य किया है पिछले 4-5 वर्षों से। एलिवेटेड शेड है यहाँ पर, और एक देसी पोल्ट्री फार्म भी है हमारे पास। आप देख सकते हैं उस तरफ कड़कनाथ की ब्रीड है और इस तरफ देसी नस्ल की ब्रीड है हमारे पास, देसी पोल्ट्री पूरी। और उसके हैचिंग और एग्स का भी हमारे यहाँ पर काम है। सोजत नस्ल पे हम एक बड़ा काम यहाँ पर कर रहे हैं पिछले इतने सालों से, और सफलतापूर्वक इस काम को हमारे यहाँ पर अंजाम दिया जा रहा है, जिसमें एक बहुत ही बड़ा योगदान हमारे डॉक्टर मदन मोहन माली गवर्नमेंट वेटरनरी कॉलेज जयपुर से है, जिनका बहुत अच्छा योगदान हमारे को रहा है। आप देख सकते हैं उनका योगदान यह रहा खास करके कि जो मेमनों को बचाना, ये मेमने जो आप देख रहे हैं, इनमें एक मेरे यहाँ एक प्रॉब्लम आई थी कि इनको डायरिया बार बार होता था। 10 दिन 15 दिन के पैदा होने के बाद डायरिया होने से इनमें थोड़ी मोटिलिटी भी हो रही थी। तो उन्होंने मेरा पूरा डाइट प्लान मेरे को पूछा, और उस डाइट प्लान के अनुरूप फिर उन्होंने कुछ चेंजेस करने को कहा, जिसमें यहाँ नज़र आया कि मेरे यहाँ प्रचुर मात्रा में हरा चारा है, रिजगा, बरसीम, सुपर नेपियर वगैरह। तो जिसकी वजह से उन्होंने कहा कि प्रोटीन की मात्रा ज़्यादा जा रही है, तो बकरी के अंदर प्रोटीन ज़्यादा जाने से, दूध में प्रोटीन ज़्यादा आने की वजह से ये बच्चों में, मेमनों में डायरिया हो रहा था। तो उन्होंने उसको एक निश्चित मात्रा में देने को कहा और फीड चेंज करने को कहा बकरियों के लिए, जिसकी बाद में एक बहुत बड़ा बदलाव हुआ, और यहाँ मेमने बच पा रहे हैं, और ये हेल्दी भी हैं और ग्रो भी अच्छा कर रहे हैं। अभी यहाँ पिछले 1.5 महीने के अंदर मुझे यह नतीजा मिला है, और उन्होंने बकरियों के भी डाइट पे भी मुझे बहुत कुछ हर देर वक्त हमेशा कुछ न कुछ सजेशन किया, जिसकी वजह से मेरे यहाँ पर बकरियों की हेल्थ भी बहुत अच्छी है। आप देख सकते हैं सोजत नस्ल।
Now, coming to next section of this diarrhea in sheep and goat, the cause of diarrhea in older lambs and kids. So the most common causes of diarrhea in older lambs and kids is always parasitic infestation, and among this parasitic, nematode infestation has been regarded as most common. The other causes of diarrhea in older lambs and kids, infection due to Clostridium perfringens type A, B, C, D, but the type D is the most common. Coccidiosis, giardia. Diarrhea in adult sheep and goats. The list of consideration in the differential diagnosis for acute and chronic diarrhea in small ruminants is very extensive. The most common cause of diarrhea in adult sheep and goats is parasitism. Another major cause is Jones disease. Other cause of acute diarrhea include rumen acidosis, peritonitis, endotoxemia, and ingestion of toxins. The list of toxins that cause diarrhea also is very long, and often diarrhea is not the primary clinical sign in case of adult sheep and goats. So by this information, we can easily understand the variation in symptoms and signs, and the strategies to diagnose, to treat the condition is always pose a very great challenge to all the clinician, particularly the field veterinarians, how we can diagnose the condition. But by having the basic information or the basic nature of the occurrence of diseases, either clinical or infective, we can easily diagnose the condition or suspect at least the condition, and we can try to control the condition accordingly. Some of the more commonly encountered toxins that produce diarrhea are arsenic, salt in toxic amounts, levamisole toxicity, copper toxicity, selenium toxicity. The pyrorized alkaloids, salmonella infection also cause chronic enterotoxemia and cause diarrhea in adult animals. The coccidiosis can occur in adult under severe stress or in animals that poses limited immunity because of lack of exposure. The presence of hepatic and renal diseases and copper deficiencies sometimes are accompanied by chronic diarrhea, but weight loss is a more common sign in adults as compared to the young animals. So they can survive the occurrence of diarrhea more as compared to the young and older lambs. Now coming to the next and last section for this, the diagnostic approaches for the diseases of digestive system. So there are certain basic laboratory studies that helps in making diagnosis. It includes the CBC, complete blood count, serum biochemical evaluation of normal electrolytes or some serum liver enzymes, examination of rumen fluid and urine analysis. These are considered always as a basic test that helps in making the diagnosis. The analysis of rumen fluid also helps in differentiating the diseases of the forestomach. Rumenocentosis carries a slight risk of peritonitis. So ruminal centosis can always be uh, should always be adapted by making appropriate conditions so that the infection cannot be transmitted and cause peritonitis. The next test or diagnostic approach is radiography. This radiography helps in detecting the gas distension of the small intestine, abdominal fluid, and foreign bodies. Unlike in other small animals, contrast techniques are not practical for catheterization. Small intestine problem in sheep and goats because the rumen dilutes and slows passage of the contrast media. However, the radiography can add important information on the condition of the head, particularly about the teeth. Next diagnostic measure is ultrasonography. It also provides better catheterization and characterization of abdominal distension, internal and external abdominal masses, and gross lesion of the liver. It also helps very usefully to differentiate the ascites and gaseous distension of the intestine. The liver can be viewed on the right side from the 7th or 8th rib caudally to the 13th rib. Ultrasonography can also help to use to guide tissue sampling for liver biopsy and other organs or masses and to locate pockets of fluid. Next is the exploratory laparotomy. Exploratory laparotomy can be a valuable diagnostic tool in evaluating the gastrointestinal diseases when other tests indicate abdominal diseases. The techniques of exploratory laparotomy used in cattle can be adapted equally for the sheep and goats with the understanding that these animals are more likely to lie down during surgery. Therefore, standing surgery should be attempted only rarely. For this procedure, a small ruminant should be heavily sedated or placed under general anesthesia. Animals that show signs of post-operative pain, anorexia, depression should be treated symptomatically. Now, coming to the last section of this presentation, this is conclusion and summary. So, I can conclude this presentation all about the common digestive problems of sheep and goats by having the knowledge or information about the significance of digestive problems, because as we discussed in the beginning, it contribute to the largest percentage of all diseases and directly affecting the performances and the price value of animals, maintaining the health, immunity. So the significance of digestive problem is very much. The etiological diversity, as we have discussed, that is a very long list and about the infectious and clinical and systemic. So it's a very great challenge to all the clinician, particularly to the field veterinarians, to diagnose the condition, the causative agent, either infectious or clinical or systemic, having only dysfunction of a only a organ or number of organs are affected simultaneously. So the diagnosis of the digestive problems must be prompt and definite to treat the condition accordingly and also to control and eliminate the economic losses. And in the last, the management practices also plays a great role in the occurrence and also in the control measures. So the management practices should, or I must say, the must be scientific, like all management and husbandry practices, including feeding, housing, deworming, vaccination. All practices should be scientifically should be growing or changing continuously. So the owner should always be educated about these advanced practices so that we all can able to control these condition digestive problem in sheep and goats.